Assalamu alaikum dear students, welcome to MLT DEC0DE. This is a general pathology playlist and the topic is the cellular adaptation hyperplasia. So you know that hyperplasia is any kind of stress. If we put on the cell, then they may increase the size or increase the number of the cell. In the cellular adaptation, when we apply stress, it may be increase in the size of the cell, number of the cell, metabolic activity may be altered, and the phenotype of the cell may also change. So this is the cellular adaptation, and hyperplasia is one of them. When we apply stress, which may be physiological, which may be pathological, which may be the hormones also, and the growth factor also. So these all contribute to the hyperplasia of cells. What is the definition? Increase hyperplasia is increase in number of cells in organs or tissue result in increased mass of the cell. So when the number of cell increase, the mass of the cells, the mass of the tissue or the organ also increase. This is the normal cell, you see. What is this? This is the hyperplasic cell. It may be pathological hyperplasia, it may be physiological hyperplasia. What cause it? It caused by the hormones in the physiological or pathological also, and the growth factor also play a role. So how do you differentiate hyperplasia from cancer? Because in the hyperplasia there is increased number of cells, cancer also increased number of cells. So how do you differentiate? Because in the cancer cells there are many mutations at the genetic level done. In the hyperplasia there is no genetic mutation done. So this is the difference between the hyperplasia and the cancer cell. Now go on the physiological hyperplasia. You know that in the physiological hyperplasia we see it may be due to the hormones, it may be a compensatory hyperplasia. What is the hormonal hyperplasia? Hormonal hyperplasia, best example is estrogen, which may increase in the pregnancy also and in the menstrual cycle, first phase of menstrual cycle, which is a estrogenic phase. Estrogen level increase, which then after the ovulation progesterone level increased, right, after the 14 days. So estrogen cause, first is the breast, so it causes proliferation of the breast also, right, and the second one is the endometrium. What is the endometrium? The innermost lining of the uterus. So in the first phase of the menstrual cycle, estrogen make the endometrium hyperplasia, right. Why this hyperplasia occur? Because if the fertilization occur after the ovulation, if fertilization occur, then the fetus grow there, and endometrium is the best place for the fetus to grow. It provide the nutrition, it provide the blood supply and the other things, placenta form there in the uterus. So this is that. Another one is the hyperplasia of the uterus. So in the hormones there may be the hyperplasia of what? Of the uterus. You know that in the pregnancy there is increase in the myometrium. Of which myometrium? Uterus myometrium. So right, there is baby in the womb, so the the size of the uterus also increase. So these and after the pregnancy the hormone level go down and the uterus come to the original position. So these are the two in the pregnancy and in the estrogen level. These are the physiological hyperplasic conditions which play a role by the hormones only. Now the other is the compensatory hyperplasia. Compensatory hyperplasia is that it occur mainly in the liver, because when we resect the liver, right, when we resect our liver or there is any kind of damage to the liver, two things there, resect, we cut the liver, or there is any damage to the liver make their cells again, they regenerate. Liver have the ability to regenerate their cells and come to the position original where they are. So there is liver, right, suppose there is liver and this area I cut, right, normally is that this area I cut, resected, but after few months you see that liver come to their normal. What is this? This is the compensatory hyperplasia. Due to the hyperplasia, liver make their this lobe again. So this is the compensatory hyperplasia which liver play. But remember that if I cut this, liver regenerate exact what is the original. It do not make more. It do not cause the increase more like this or mass of the cell. No, it is in this place which is the anatomically original. Right, this is the compensatory hyperplasia. Neither it increase more or neither it decrease less. And for example, I cut the liver and the liver now start to release the growth factors. Right, these are the growth factors. Liver release growth factor. Why liver release? Because I cut this section, liver want to make it again, so it release the growth factor. These growth factor work on the those cells which are not resected, and the entire area which I cut will made again. But remember that suppose that there is a hepatitis in the liver, so that in condition where there is hepatitis inflammation of the liver, then these growth factor not work on these cell. Now how liver make these cell? From the stem cells in the liver also have their stem cells, and these growth factor work on the stem cell alternate mechanism, stem cells. So they alternately work on the cell because there is hepatitis going on the liver. The stem cell make this liver back to the original position. So this is the whole mechanism. If there is hepatitis, then this growth factor act on the stem cells, and the stem cells make the liver again. So now I will tell you about the pathological hyperplasia. What is the cause of the pathological hyperplasia? This is caused by the excess hormones. So if the hormones are made in the body and they are in the excess level, they are more than the normal, then they cause the pathological hyperplasia. One example is the estrogen. So you see the estrogen example in the hormonal physiological hyperplasia. If the estrogen is increased more than the normal, then what could it cause? You know that it act on the endometrium and cause the hyperplasia of the endometrium. But in the first 14 days and estrogen level increase, then it declines. But when there is any kind of pathological which disease or state which increase the estrogen level, then there is increase in the endometrial hyperplasia. If the hyperplasia persists for many time and we cannot treat it, then what is the complication of this? Then there may be the endometrial carcinoma, cancer also caused by the high estrogen level. So there is high estrogen level which cause the endometrial hyperplasia, and because there is prolonged endometrial hyperplasia due to the estrogen, the menstrual cycle will also disturb, and there is irregular bleeding also occur in the end of the menstrual cycle. So if it persists for long time, then the endometrial carcinoma also occur due to the increase in the estrogen level. So this is the pathological hyperplasia. Remember that in the pathological hyperplasia, what will you write? That this is the excess hormone. So there is excess estrogen hormone. So this is the pathological hyperplasia. Now see the next example. Now the next example is the benign prostate hyperplasia. Benign prostate hyperplasia. So what is benign prostate hyperplasia? It is increase in the number of cells where in the prostate. Where is the prostate? Prostate there you see that it is the prostate, right? And this is the our urinary bladder. This is the urinary bladder, and this is the our normal prostate, right? But I tell you that pathological hyperplasia is due to the excess hormones. This is normal, and you see this. What is this? This is the benign prostate hyperplasia. Hyperplasia the prostate occurs, and what is the hormone? What is the hormone which produce in excess? This is hormone is the androgens. Androgens are those hormones which cause the benign prostate hyperplasia, and this is very important. I made this so you remember that this is the urinary bladder and the prostate present inferior to the urinary bladder. This is the viva question. This is the viva question also very important, and let's see that this condition is only occur in the males. Why? Because prostate is only present in the males. So when there is the normal prostate, there is the normal flow of the urine from the bladder, from the bladder to the uterus. But when there is the hyperplasia, you know that you see that there is very big prostate. So it also block the flow of urine which come from the urinary bladder to the urethra. This is the blocked. Urine can't flow from the urinary bladder to the urethra to the outside. So this is the diagram. This is the bladder, and this is the pathophysiology. Androgens play a role, and this occur only in the male. So males affected. And age group. What is the age group? It is maybe older people which are males. They are the very affected in benign prostate hyperplasia. And the last example is the human papilloma virus. Human papilloma virus, which you know that it is a virus which can cause very importantly warts. So warts are the benign condition. Warts is also a cluster of cells, right? The human papilloma virus causes wart, which is a cluster of cell or hyperplasia of that tissue, which is the warts. So warts occur in many area in the body. This is due to the human papilloma virus, which is transmitted by the sexual contact, and it is a benign condition. It is not a malignant condition. It cannot spread from one area of the body to the other area of the body. It is only the benign. So benign from you know that benign is that condition which is at located area, one area, not its spread. So student, this is all about the hyperplasia topic. If you like my video, then please subscribe and like my channel. The MCQs of this topic I shall made, and inshallah upload soon. Okay, take care students, and Allah Hafiz.